Okay.
Okay, I'm gonna resume our recording. Paula, if you want to give everybody an overview of Care Patrol, and then we'll meet some of your Care Patrol team members, and then we'll meet Debbie and we'll talk about Medicare.
Great. Thanks, Steve. And thanks, Sonia, for helping us with this. So I'm Paula Sotier. I'm the owner of Care Patrol Baltimore. We cover most of Baltimore County, all of Baltimore City and Hartford County. Care Patrol helps seniors find safe living options at no charge to them. We typically do help people find assisted living and memory care. We are local and hands-on. Our process is that we understand our clients' clinical needs today and the future. We learn where they want to live, what they like doing, as well as their financial capabilities. A client about 2 years ago said I was a matchmaker, and the reason they said that is because we matched the client's needs with our safe communities. We're really able to be successful in doing that is because we understand the community's clinical capabilities, their staffing ratio, which is really important now, what amenities they have. And we also learn about their quality issues by reviewing their state surveys. Since Care Patrol places so many clients, we have real-time experience with understanding the care capabilities for our clients. We assist the seniors and their families through the whole process until they're placed. You know, all of the Care Patrol team here, we know how hard it has been to place a loved one during the pandemic, although I do think it's better with vaccines and some of the new treatment options. The good news is Care Patrol, again, has real-time information on the community's visitation policies if, unfortunately, one of their employees gets COVID. This information has really been invaluable to our families. I'm so lucky to be part of the Care Patrol team. We have 7 franchises that covers all of Maryland, all of DC, and parts of Virginia. We have placed over 3,000 clients in over 1,000 communities. We're actually so excited to hear from Debbie DeChambeau to understand how we can enroll in Medicare. Thanks.
And this is great. So, okay, before we get to Debbie, let's spotlight the other Care Patrol team members. So to make my life easier, if in here, I'm gonna, okay, I gotta get Paula off the spotlight. So if the Care Patrol team members that are on the call today, if you could raise your virtual hands, then I will will turn over the mic to each of you. Well, Charles, I see you on the screen right now. Would you like to go first and tell us what region you serve?
I would be happy to do that. Thanks, Steve. My name is Charles Picard. I am with Care Patrol. My predominant area is Prince George's County, but I also work along with Bonnie Danker in the District of Columbia, and I work in Charles County as well. Welcome everybody to our Care Patrol education series.
Great. And I see Rhonda Thomas has her hand raised. Rhonda, if you want to go next. Whoops. Oh, let's unmute you. There you go. Sorry.
Yeah, good afternoon, everyone. My name is Rhonda Thomas. I'm the Senior Sales Consultant and Marketing Liaison serving Howard County, Montgomery County, and the District of Columbia. Welcome.
Great. And let's see, the next Care Patrol team member, just feel free to just take over the mic. David Gutierrez, do you want to go next?
Sure. Good afternoon, everyone. I'm David Gutierrez, and I work in predominantly the Anne Arundel County, Maryland area, as well as a little bit of a pocket near Catonsville, Maryland as well. And I work with 3 other counterparts, Cindy, Jar Evans, Myra, and Ellen Christian. So we're glad to be here today.
Great. And I'm just going down the list with some of the names I recognize. Star Sowers, would you like to share where you serve?
Yes, hi, it's good to see everybody today. I work in Howard County, Montgomery County, and part of DC with Bonnie Danker. Good to have you.
And with that, we've got Bonnie Danker on the call too. Bonnie, would you like to say hello? Whoops, here. Oh, I'm sorry. We're both clicking the button at the same time. If you want to unmute again. Oh, okay. I'm not going to press it again. Bonnie.
Can you hear me now? Good afternoon. So happy you're here. So happy to see so many folks who have been attending some of our previous programs that are with us again today. And we're very excited to have this topic to offer because we have so many questions that come up, and we're really happy to have this opportunity to share the information with you. So thank you.
Great. Sorry about that, Bonnie, too. And
No problem.
let's see. Looks like, have we had Robin Edwards yet? Robin, if you want to unmute and introduce yourself.
Good afternoon and welcome everyone. I'm Robin Edwards with Care Patrol of Northern Virginia, serving Fairfax, Arlington, Alexandria, and part of Loudoun County.
Okay, and I'm scanning the list. I think I have all the Care Patrol team members recognized, but if there's anybody who I missed, just open your mic up and introduce yourself. And if we don't hear from somebody, then we are really, so what I would say to the audience is that if at this point, if you can just make sure that you turn your audio off, we are going to spotlight Debbie DeChambeau. Did I pronounce it correctly?
Perfect.
Who is going to share with us some resources for Medicare, which as Medicare open season comes up, it's this is very important. But before you dive into that discussion, Debbie, can you tell us a little bit about your background and what led to your career, what you're currently doing in your career?
Gotcha. Thank you. Thanks everybody for being here. I actually started in the insurance business when I was 15 years old. My dad had his own insurance agency and I started working for him. Over the years, I primarily focused on business insurance. So for any of you who are business owners, I would have been the person that would have written your general liability and your workers' comp and your commercial auto insurance. That's what I did. Then I took a little break to raise my kids. And then during that time frame, I was also taking care of my parents. I'm a little bit different than most people. I have 9 parents, of which I've cared for most of them. So I can see things from the caregiver's perspective. I know what a caregiver goes through, and I know what many of you go through who are taking care of the seniors in your life. So it was from that caregiving that I was like, I need to be back in insurance, and Medicare is where I need to be because I realized how complicated it was.
Wow, that's great, Debbie. We're really glad to have you. And okay, so what I'm going to do is I'm going to drop behind the curtain here and turn the stage over to you. And if you want to just start sharing some resources and things that people need to know, and for the audience, if you've got questions, if you can either type them into chat or raise your virtual hand, we will make sure that we address your questions as they come.
Gotcha. So what I want to do is I've got about 3 different areas I want to cover today. So I'd like to ask that you hold the questions for the end, like put them in the chat, whatever, but let me get through what I'm going to get through and
sounds
then
great.
Back and regroup if that's okay with everyone.
Okay, that sounds great.
What I'm going to start with is we're calling, I've heard this said a couple of times, open enrollment period. The invitation said annual enrollment period. So I'm going to talk to you about the right terminologies because it can be confusing. In our world, it's a bunch of acronyms, and it all starts with what's known as an SEP or a special enrollment period. So a annual enrollment period falls underneath of a special enrollment period. An open enrollment falls underneath of a special enrollment period, but there are certain times when people can change their plans. Some special enrollment periods might be if somebody moves from one county to another or one state to another. That could trigger a time when someone can change plans. If there's some sort of an emergency and FEMA calls it a catastrophe, there could be a special enrollment period created there. If someone is on Medicaid, that could create a special enrollment. Or if someone loses Medicaid, that could contribute a special enrollment. But for our purposes today, we're talking about the annual enrollment, which is from October 15th to December 7th. And during that time frame, it's when people can change their plans, and the two big plans that we're looking to change are prescription drug plans and Medicare Advantage plans. And I'm going to talk a little bit about those two plans and things that you as the providers can be aware of to help the people that you take care of. And for some of you, this might be helpful for yourselves too. So I'm going to start with prescription drug plans. And anyone who has just a standalone prescription drug plan, in my opinion, should take a look at that prescription drug plan every year. And here's the reasons why they should take a look at it. One, those plans change from year to year. The premiums can change, the copays can change, and that can have an impact on the beneficiary. Also, many people might have prescription changes. The drugs that they were taking last year might not be the drugs that they're taking this year. Therefore, a new plan could be beneficial for them. Also, some plans change their preferred pharmacies. For example, SilverScript is owned by CVS, and their preferred pharmacy is CVS, believe it or not. But Humana has a preferred plan for Walmart, which is going away as the preferred pharmacy. So from the preferred pharmacy perspective, it's always good to take a look at the plans every year to make sure that you're still going to the preferred pharmacy. But the biggest reason why you need to take a look at the plans every year is insurance companies change the formularies. Now, formulary is the technical term. Many of us would think of it as the drug list. But they have drugs that they like, and they have drugs that they don't like. And so we want to make sure that the drugs that you're currently taking are the drugs that that plan likes. I met with someone this morning who's taking a medication, and on the plan she was on last year, it was a tier 1, which means that she paid nothing for that medication. We looked at the 2022 plans for her, and that same medication moved up to a tier 3 on that plan for 2022, which means her cost went from $0 to $46 for that particular plan. So that's the big reason why it's so important to take a look at your prescription drug plans every year. So if you're working with people, that your clients, that's a question that you want to say to them is, did you have somebody take a look at your prescription drug plan this year to make sure that it's going to be the right plan for you for 2022? So we can look at them now. They're actually available to look at between October 1 and October 15th. But we can't actually enroll someone in a new plan until October 15th. So if you go on to Medicare.gov, if you're familiar with everything that I'm talking about, you can actually go and see the plans that are going to be available for 2022. If you're not real familiar with how all this works, someone like me who specializes in prescription drug plans can do a quick review, and someone like me should not charge for that quick review. For most people, and you may or may not know this, but a prescription drug plan is offered by the government, and by insurance companies, not by the government, I apologize. They're offered by insurance companies, but the government manages them very closely. The Centers for Medicare and Medicaid manages what the insurance companies do very closely. We have a lot of compliance with what we do, and there's a lot of rules that we have to follow to make sure that the Medicare beneficiaries are properly taken care of. So again, just ask everyone you know that's on Medicare if they're doing a review for 2022. Now, the other part that I want to talk about is the Medicare Advantage plans. And these, if you're watching any television, if you're seeing Joe Theismann come on and talking about all the benefits that you could get, or JJ coming on and talking about the benefits, and I think it's Joe Namath as well is the third one out there talking about it. They're talking about the Medicare Advantage plans. And a Medicare Advantage plan is, if you have a Medicare Advantage plan, you don't have a separate prescription drug plan, most of the time, that prescription drug plan is rolled into the Medicare Advantage plan. It's also known as Part C. I heard someone earlier before we actually started the presentation today say that they had some people who were looking to make a change from Kaiser. Kaiser would be a Medicare Advantage plan. So here's a couple of things about a Medicare Advantage plan to kind of keep in mind. One of them is it's like traditional health insurance. And from that perspective, they have an HMO network or they would have a PPO network. So they have different doctors that they need to go to. Contrast that with original Medicare. With original Medicare, you can go to any doctor anywhere in the country. The only exception is they have to accept Medicare. With a Medicare Advantage plan, they differ from county to county, state to state. And that's the important thing to keep in mind. So someone who lives in Montgomery County might not have the same options as somebody who lives in Wycomico County. They're just that different from county to county. And in addition to who offers what, the details inside the plans can be very different as well. So the things that change in a Medicare Advantage plan each year, at least what we're seeing so far, is the doctor networks can change. Someone who accepted a Medicare Advantage plan last year might not accept a Medicare Advantage plan this year. The copays could change again. But the biggest feature in a Medicare Advantage plan that can change, and this is where all the commercials are talking about, is the extra features. And I want to elaborate on these for just a minute because this is where it could be very beneficial for some of your clients to take a look at these plans. Now, before I go into the extra benefits, I want to stress a couple of things about a Medicare Advantage plan. One is they're very attractive from the perspective of oftentimes they have a low monthly premium. But what people don't always talk about in a Medicare Advantage plan is the out-of-pocket costs and the potential maximum out-of-pocket cost. In my opinion, those are the two things that somebody needs to look at before deciding to go on to a Medicare Advantage plan. If you have someone that has some reserves put away for their health insurance costs, that maximum out-of-pocket might not impact them. But if you have someone who's on a lower income and they're not healthy and they have the potential for going into the hospital a couple of times a year, that maximum out-of-pocket could wipe out some of their savings. So it's important to always pay attention to the maximum out-of-pockets. In our region, in Maryland, Virginia, DC region, right now in 2021, most of those maximum out-of-pockets is between $6,500 and $7,500. If you were living in Florida, just to kind of compare how they changed, there are plans in Florida that have a $1,500 maximum out-of-pocket, so to kind of give you a difference there. So let me talk a little bit about some of the extra benefits, because this is where a lot of people are like, oh, I want this plan because of the extra benefits. And in some cases it can be good, so long as that maximum out-of-pocket and the copays match up and people understand that piece of it. So one of them that's good, especially for somebody who's on a middle to lower income, a lot of the plans have what's known as over-the-counter benefits. The benefits change from plan to plan. Some plans give $25 a quarter. Some give $25 a month. It just depends on the plan. But those over-the-counter benefits could be used for something like vitamins or compression socks, or some of the plans let them save up their money and they could get a blood pressure machine with something like that. So an over-the-counter benefit in some of the plans can be beneficial to the beneficiary. Some of the plans offer something called meals for short duration. What that means is if someone goes into the hospital, when they come home from the hospital, they'll get, depending on the plan, 7 to 21 meals delivered to them so that they don't have to worry about cooking when they're recovering from being in the hospital. Some of the plans include transportation. So if you have someone who needs to get to the doctors but might not have a car, the plans can provide transportation. And again, it varies from plan to plan. Some offer 6 trips, some offer 24 trips. It really depends. But it can be a good benefit for someone. Some plans offer what's known as the fitness benefit, and this attracts a lot of people, and I think it's the wrong reason to select this plan, but it's silver sneakers. A lot of people are familiar with silver sneakers. And that's something where people can get a gym membership as part of their health insurance benefit. Most of the plans offer dental and vision. Some of them offer hearing. So for someone who needs to get some dental work done, they're very attracted to the dental and feature of a plan. Always want to point out though, you've got to look at what the actual benefits are. Just because it says it has dental doesn't mean it's that much dental. Oftentimes the dental is just a couple of cleanings a year. But for some people, that's all they need, and that can be extremely beneficial for them. In 2022, there's a couple of cool benefits coming out with some of the plans. I'm not sure if any of you have ever heard of Papa Pals, but Papa Pals, is my understanding, is an organization of college students where they'll contact seniors and have conversations with seniors to avoid the loneliness factor. Some of the plans are offering Papa Pals as one of the benefits. There was a plan that was introduced to us, it's a Virginia plan this year, where if someone has a service dog, the plan will actually pay for the food for the service dog. Now that's a little bit of a stretch, but that's an example of some of the extra benefits that are built into the plan. So I want you to be aware of these Medicare Advantage plans. They can be beneficial for some people, but I also want to encourage people to watch out for what the deductibles are, what the co-pays are, and also what the maximum out-of-pocket amounts are. Okay? They're good for some people, but they're not good for all people. Now, along the Medicare Advantage plan route, if you will, there are some plans that come without prescription drug plans. So you always have to pay attention to that. But I bring this up because those plans can be really good for veterans. So do you know a veteran? Do you know a veteran who goes to the VA or maybe has to drive 3 hours to get to the VA in order to get care? A Medicare Advantage plan that does not have a prescription drug plan can be beneficial for those veterans. Not someone who's on TRICARE for life. We don't want to put them in that category, but those who are just regular veterans through the VA. A lot of people don't like the service they get at the VA, and they can actually go and see a doctor through these plans. They can get the gym membership if that particular plan in their area offers it. They could potentially get those transportation benefits. They could potentially get that Papa Pals benefit. Just depends on the plan, where they're located, as to what's being offered in that area. But a lot of people don't realize that they're available for the veterans. And here's the other kind of nice feature for veterans is that oftentimes the plans will have a give back. So they'll give them anywhere from $20 to $60. It really just depends. And they can use that as applied towards their Part B as in boy premium to help to reduce that cost as well. So just know that that's out there. And if you know a veteran, know that they can inquire about a Medicare Advantage plan that does not have prescription drug coverage. So the other thing I want to talk about is something called extra help. A lot of people don't realize that there is extra help available for them from Medicare. It is based on their income. But if you have someone who's making less than $20,000, if they're not getting extra help from the government, I want you to encourage them to apply, and I'm happy to send whoever the forms for this. It's a federal program. It's my understanding statistically, it's something around 40 or 50% of those eligible never apply and don't realize that they're eligible for some of this extra help. There's a second program if they don't get the extra help that's available in many of the states, not all of the states, but particularly in Maryland it's available, where you apply and you can get extra help with your prescription drug costs. For some people, and again, it depends on the income level, but for some people, they'll get a dollar amount applied towards their prescription drug premium. And for some people, they'll actually get some money applied to their actual prescription drug costs. So I want you to be aware of those two things that you can talk to the people that you're working with about to make sure that if they've got that lower income, they've at least applied for these extra benefits, because if they don't know about them, they don't know to apply and they don't know that that extra help is there. That's really all I wanted to cover today. I figured we'd spend a lot of time with questions. I'm sure a lot of you have different questions to ask, and we'll go from there.
Yeah, we got a few questions here. First is from Jean Parker, and she says, I found Medicare Advantage, whoops. Oh boy, sorry. I found Medicare Advantage to be a disaster for me due to immediate funds needed to simply have an MRI. Any thoughts on that?
That goes back to the copays, that you have to pay those copays upfront. That's why I tried to stress, you want to look at the copays, you want to look at the maximum out of pockets and the deductibles. But yeah, that's why.
Okay. And then Rolette Gooding says, can you speak to home health, skilled and non-skilled coverage, please?
No, I don't know enough about that. As a general rule, there's limited coverage there. As an insurance agent, generally when people are looking for home health, they're getting it through extra coverage, but not through Medicare. There is some limited coverage. I don't want to say there's none, but I don't have the specifics without doing a little bit of research.
Okay. And then Stephanie asks, why is the fitness benefit the wrong reason to select a Medicare Advantage plan?
Let me tie that back to that first question. When you have all of those out-of-pocket costs, you shouldn't look at the fitness benefit as the only thing. You want to make sure your doctors are in that network. You want to make sure your medications are covered. You want to make sure that if you got sick, you have the funds in place to cover that maximum out of pocket. If you have $7,500 in the bank to cover that, those are the questions to address before you say, yeah, there's a fitness benefit attached. I really like that. That's the deciding factor for me.
Okay. And Bonnie asks, does the extra help program reimburse for anything other than prescription drugs?
Yes. So there's two different levels here. There's the extra help that you can apply for. And again, depending on the income, that extra help could actually end up paying Medicare Part B premiums. It could end up paying the deductibles and the copays if you had a Medicare Advantage plan. So it really just depends on the income level. We call it LIS, low income subsidy, as well. But it's also, people just need to apply because I don't think enough people know that that help is out there for them.
Okay. Nico Masterson says, how do we access the drug plans on the Medicare.gov website? Where is it found?
You go to Medicare.gov, it should be right there at the top. I mean, I live on this website. Let me just pull it up real quick. I'm not sharing my screen, but I'm going to walk you through where it is. If you you can either have your own account or right now at the top it says preview the 2022 health and drug plans. When you click on that little tab there, it will ask you a couple of questions. Actually, it says log in without creating an account. But then it asks you a few questions like, do you want a Medicare Advantage? Do you want the Part D? You decide what you want, you put in your zip code, you scroll down a little bit and it'll ask you what your income level is, if you're getting Medicaid assistance, if you're not sure, if you're not getting it. And then it asks you what your drugs are that you're taking, and then it'll take you to the prescription drug plans.
Okay. And let's see. Okay. Leslie asks, is Medicare Part C generally good in Maryland? I have had the impression that they have not taken off enough in this state for the plans to deliver on the program extras that they advertise.
I'm in agreement with that, but I'm trying to be neutral.
Okay.
That's why I'm trying to emphasize you have to look at the max amount of pocket. You have to look at the copays. Yeah, if somebody goes into the hospital, some plans you have to pay a certain amount for the first 5 or 7 days. Some just have to pay one amount. You have to look at those factors first. Some people who are really healthy are like, I'm not worried about going to the hospital, I'll deal with it then. I'm not saying that's the right thing, but it is what people do. Some people are like, I can get a policy for $40 a month. That's a lot better than the $160 for a Medicare supplement. So everybody's situation is different, and therefore everybody, what works for one doesn't necessarily work for another.
Okay. Marilyn says, how does supplemental insurance relate to Medicare Advantage and Medicare?
So let me draw a line down the middle. On the left side of the column, you would have original Medicare, which would pay 80%, and a Medicare supplement, which would pick up the other 20%. On the right side of the column would be your Medicare Advantage. You either have what's on the left side of the column or you have what's on the right side of the column. You can't mix the two. So for the most part, a Medicare, the original Medicare, if you just have Part A and Part B, the original Medicare is managed by the government. The insurance company picks up the other 20% through the supplemental policy. On the Medicare Advantage side, on the right side of the column, the insurance company is managing the entire process. Did that answer? I hope that answered the question.
Okay. And then let's see. Now, this is a long acronym here, but Leslie asks, is MD-SP-DAP still available?
Yes, that would be the state prescription drug plan for Maryland. And
Okay.
what I encourage people to apply for. I talked about the extra help, and if they didn't get the extra help, they apply for the state plan, and that's what I was talking about.
Great.
State has a version of it. Maryland has one and Delaware has one. I don't do a lot in Virginia. I'm licensed there, but I don't have a lot of clients there, so I haven't done a lot of that yet, but I'm pretty sure that they have their own version of it.
Paula says, I've found that some of our geo-psych hospitals will not accept Medicare managed care. It really puts our clients at a disadvantage. Any thoughts on that?
When you say the Medicare managed care, I'm assuming you're referring to the Medicare Advantage piece of it?
Probably.
If you're referring to the Medicare Advantage piece, that's why it's the networks. It goes back to, is your doctor in that network? Is your facility in that network? And I mean, this is how plan specific this gets. You could have a doctor, and you know, a lot of doctors' practices have 4 or 5 offices today, and they circle around to the different offices. You can have one doctor that might have an office in Rockville, and the same doctor has an office in Annapolis. He might be signed up for one particular Medicare Advantage plan at the Rockville office, but not accept that same Medicare Advantage plan at the Annapolis office. So you not only have to check the doctor, the practice, but we have to check the street location to make sure that it's the right street location for that particular plan.
Wow.
So it's very complicated. Like people who want to go to the Mayo Clinic, most likely they are not going to accept the Medicare Advantage plans.
Okay. Tim says, I'm having trouble comparing prescription plans under Medicare C, Medicare D, in my Blue Cross Blue Shield federal employees program, and which formulary to review. Any thoughts on that?
So the federal plan is an animal of its own. I've read the documents, but I don't deal with it that much. My recommendation in that scenario is to contact I don't know if you go to OPM or your local HR person for guidance on that. If you wanted to leave the federal program, there's a couple of, that's where you would be able to compare the prescription drug plans on the Medicare.gov website. But I think for the federal programs, you have to go and look specifically at the federal program and what they're offering. It would be the same thing as if you had worked for maybe the county, or I worked with someone yesterday who worked for American Airlines. They have their own plans, and so you have to go to those websites to do the analysis.
Great. And Debbie, would you mind putting the extra help, a link for the extra help program into chat? Someone had requested that.
Yeah, I saw that. I don't have a link. I only have a PDF. I don't know.
Okay, or just if you put your contact information into chat, then folks can reach out to you.
Okay.
Charles asks, why in some of the Medicare Advantage plans, Kaiser specifically, the insurance company takes on the role as the primary payer rather than Medicare being the primary payer? this becomes a restrictive proposition for healthcare coverage.
That's correct. That's the difference between, remember a few minutes ago, I said we have that line down the middle and we have original Medicare on the left side and Medicare Advantage on the right side, and you can't mix them. It's two different animals. It all comes under Medicare, but you have two different choices. So I think that the government is looking to get away from managing Medicare, and they're encouraging people to get onto the Medicare Advantage plans because the insurance company then manages it versus Medicare and the government having to manage it. But original Medicare is a lot more liberal freedom for where you go and who you see than the Medicare Advantage plans. It's much more restrictive and a lot more out-of-pocket costs.
Okay, great. Well, let's see. Any other questions? This has been really, you provided a great overview. Any other questions? You can either type it in or raise your virtual hand and we can call on you. And if not, we can get ready to spin the wheel. Marilee says ads talk about getting money back.
That's correct. That's, well, it can be seen in a couple different ways. That when I talked earlier about the veterans program, there is some Medicare Advantage plans that money back to veterans. And the veterans, but that money goes to their Part B as in boy premium, not directly into their pocket, but that's an incentive for veterans to use the program. Other ways where you might see money back, I had talked about some over-the-counter benefits or some meal benefits. Some of the plans will give people a credit card of sorts that can be used, and they'll put $25 on it or $50 on it, depending on the plan, that can be used for buying some of those over-the-counter benefits. So that could be perceived as money back as well. But as a general rule, except for those two scenarios, they're not going to get money in their pockets. Let me address the ads for a minute, because this is a real problem, and this is where you can add information to the people that you're talking to as well. Those ads are very deceiving, and they're constantly being run. They're being run by call centers, not by the government. So most of the call centers are in the US, but they are being run by call centers. And they'll talk about money back as if it's in your area, but all those plans aren't the same all over the country. There was just correspondence put out, I don't know if it was Friday or Monday, by the Center for Medicare and Medicaid that is really cracking down on those commercials because too many people have called and complained about them being misleading. So remember that if it seems too good to be true, it is, and it's only a commercial. And you always have to double check what the commercials say because they can be spun a little bit.
Okay. Well, let's see. Bonnie says, does Medicare Advantage plan play for hospice services the same as standard Medicare?
They're starting to. Part A covers the hospice for original Medicare, and they're starting to. They haven't all in the past. So if that's a concern, you have to go plan to plan. It's not standardized yet. I would imagine in the future it will begin to be standardized, but I'm going to say in 2020 it definitely wasn't standardized.
Great. Okay. I think we're good to go. So let's see, Debbie, how about you do the honors here? And let me see if I can share my screen. And you want to spin the virtual wheel of names for us? Raise your hand and spin away.
How do I do that?
Oh, just go, just here we go. Say spin the wheel.
Spin the wheel.
There we go. Let's see who's the winner. It's Annette Wilderson. So congratulations, Annette. And then let's see if if one of the Care Patrol team wants to jump on and share what this, let's see. This is another question came in. Leslie says, some of the Advantage plans are very aggressive and sign up seniors without the senior really understanding. I've had to undo that several times for clients who did not understand. Any
Yeah.
thoughts on that?
I think this is the problem is, there's a lot of sleazy insurance agents out there. And I'm an insurance agent, so I want to be clear about that. If I sign someone up for a Medicare Advantage plan for the first time, this year the commission on that is almost $600, not 100%, but almost. So a lot of people will move people over to a Medicare Advantage plan because there's money in it for them, but it's not always the right thing. That's why I have to be impartial here because of compliance purposes, but it is why I stress you've got to pay attention to the networks. You've got to pay attention to the copays, the out-of-pocket costs, the maximum out-of-pocket, because it's not right for everyone. It's really not. And they don't understand it. And what I believe in, to the bottom of my heart, is as we get older, we need simplicity. We don't need things that are complicated. And I feel like the Medicare Advantage plans can be very complicated, because you have to know what's the copay for this, what's the copay for that, what's the coinsurance amount for this. Oh, I didn't know that. And there's just so much built into it. It's hard to know. So
Great. And then Marilee says, how do I find a reliable agent? And Tim says, is there a consumers union objective reviewer to monitor all these?
So let me answer the second one and then I'll come back to the first one. With respects, I don't want to say there's a consumers union, but it is CMS, Centers for Medicare and Medicaid. If you have a problem, that's where you go to report the problem. And they're all about taking care of the beneficiaries, and that's a Medicare term for people who are on Medicare. Okay, so from that perspective, if there's a complaint, they're out there looking at it. There are insurance companies who have not done the right things, and they have lost their contracts. There's a couple of them out on the West Coast that lost their contracts this year. So they are out there slapping hands. The compliance that I as an agent have to go through is really steep. I mean, just this sort of ties into what Marilyn had asked, but in order to sell Medicare, and I'm going to specifically say prescription drug plans and the Medicare Advantage plans, in order to sell them, every year I have to take a test. It's called AHIP. And in taking that test, we have to pass it with a 90% or better, and we only get 3 tries. And then for every insurance company that we represent, we have to certify with their program. And generally we have to get an 80% or better with their certification as well. So how do you find a reliable agent? Ask them, 1, how long have you been in the business? But 2, have you passed your AHIP? Did you pass your carrier certifications? What carriers did you get certified with? And I would ask how long they've been in the business, because if you've got somebody who just started this year, probably not going to be as knowledgeable as somebody who's been doing this for a couple of years. But there's a ton of training for people who work in the Medicare space. How do you find the reliable agent? Ask for referrals. And I'm one.
Great. All right. Well, this has been fantastic. Debbie, you're an invaluable resource. You've got your contact there in chat. We recorded this. And thanks again to the Care Patrol team. Another wonderful discussion. And I think we got through everything. So thanks everybody. We'll see you next month.
Thanks for having me. I really appreciate it.
Okay, great.
301-996-2328. Debbie.